Welcome to this edition of SKNIS Week in Review, a program highlighting the top stories of the work of the government of St. Kitts and Nevis for the past week. Here's a look at some of the highlights for the week of February 25th to March 3rd, 2022. Cabinet approves changes to health and travel protocols. CDM audit significantly important to the Federation. At-risk individuals afforded a second chance through ALPP initiative. And St. Kitts and Nevis moves closer towards a safer and stronger future. I am your presenter, Sherima Matthew. With significant investments made over the last 7 years to bolster national security, Prime Minister Dr. the Honorable Timothy Harris has said that the Team Unity-led administration is experiencing significant movement towards achieving a stronger and safer future for all citizens and residents.
In our support for law and order, the judiciary, and in the build-out of our socio-economic programs, the Team Unity administration has been delivering on its commitment to keep our people safe. In this regard, it is important to note that the highest ever level of financial support provided to our people's safety and security was in 2020, when $99.2 million was budgeted to national security. This was up 40 million or 68% above the $59.4 million budgeted for the year 2015 by the bygone administration.
The National Security Minister said that his government's success in crime fighting is as a result of substantial investment in the security infrastructure. This includes building new and renovating other police stations, Defense Force and Coast Guard facilities, investing heavily in its CCTV monitoring system, providing an adequate supply of vehicles, and the construction and build-out of a forensic laboratory. Closed-circuit television CCTV surveillance cameras are widely used in policing and now serve as critical crime-fighting tools in the Federation of St. Kitts and Nevis, said Julian Marishaw, Acting Telecommunications Officer at the Telecommunications Department of the Royal St. Christopher and Nevis Police Force.
CCTV is used as a crime-fighting tool, such as the department plays a critical role in the overall strategy of the police force to keep St. Kitts and Nevis safe, a safe place to live, play, work, and to raise families. It is an initiative that requires a large amount of investment to get off the ground and continuous investment to keep it up and running properly. Because it was considered the important part of the strategy to maintain security, the government of the Federation invests millions of dollars into the project already.
According to the Acting Telecommunications Officer, Phase 1 of the CCTV project was rolled out in 2017 in the Bastille, Frigate Bay, and Connery communities. Following an assessment of the various locations, the cameras were strategically placed. At present, Phases 2 and 3 are currently ongoing. Phase 2 is being implemented on the eastern side of the island, and Phase 3 covers Nevis and is being implemented with the assistance of the Nevis Island Administration's Technology Department. The CCTV system is solely operated and maintained at police headquarters in Bastille. Unless there is a technical issue with the cameras, they record 24 hours a day. Incoming travelers will experience even less restrictions as the Federal Cabinet of St. Kitts and Nevis granted approval for 3 changes to the Federation's health and travel protocols effective March 1st, 2022, said Chief Medical Officer Dr. Hazel Laws.
No quarantine for persons coming in with any of the 5 following vaccines. These vaccines have not yet achieved WHO emergency use listing, and these vaccines are 1. Abdala vaccine, 2. Sabarana 2 vaccine, 3. the Sabarana Plus vaccine, 4. the Medigen vaccine, and 5. the Sputnik vaccine. Individuals who are coming from Cuba or Taiwan or coming in with any of the 3 vaccines available in Cuba, that vaccine, the Medigen vaccine available in Taiwan, or the Sputnik 5 vaccine, they will be allowed to come in and they will not have to serve a quarantine period.
The second change relates specifically to unvaccinated nationals who are coming into St. Kitts and Nevis. Previously, they would have had to quarantine for 9 days at a government-approved quarantine facility or at home with paid security. This quarantine period has been reduced to 7 days and can be completed at home without the paid security facility. Additionally, persons in the Federation who are planning short trips will also benefit from the changes.
Such individuals who leave the Federation and travel to a neighboring island for less than 24 hours can return by completing the entry form on the URL as noted on the slide. They are also required to submit a negative COVID-19 test done prior to departure. So for example, if you're going to St. Martin and an antigen test is required to go to St. Martin, you can upload that negative test onto the platform and you can get approval to return on that test. However, travelers will be tested for COVID-19 upon arrival back into St. Kitts at RLB or Vance Amory Airport. So if you're coming in by sea, you can access testing through any of the laboratories on island.
The other health and travel protocols remain unchanged. All incoming visitors must be vaccinated, and all inbound passengers into the Federation of St. Kitts and Nevis are required to complete and submit the Customs, Border and Health entry form found at www.knatravelform.kn before departure. They are also still required to submit a negative RT-PCR test done within 72 hours of travel. With the 4th wave of the COVID-19 cases, the Omicron variant now under control in St. Kitts and Nevis, several internal protocols will end shortly, said Dr. Cameron Wilkinson, Medical Chief of Staff at the Joseph N. France General Hospital, during the New York COVID-19 press briefing on Wednesday, March 2nd.
We have passed the surge in COVID-19 cases we experienced in the 4th wave that started on December 24th last year. We don't need to be operating in emergency mode anymore now, and we will begin to see a significant relaxation of control measures internally as we attempt to get back to some sense of normalcy. Serious cases and deaths remain at an all-time low, despite the fact that the virus is still circulating in our community. We now have 4 confirmed cases in St. Kitts and 0 in Nevis, and this is great news.
Dr. Wilkinson made a clarion call for everyone to continue practicing the non-pharmaceutical measures, including the frequent washing of hands and hand sanitizing, social and physical distancing, and wearing masks in public, as such measures, and I quote, still help with the reduction of viral transmission, end of quote. He also encouraged the general public to continue to adopt the, and I quote, COVID-19 appropriate behavior, end of quote, in their everyday lives. The disaster management offices of St. Kitts and Nevis underwent a comprehensive disaster management CDM audit, a project that was described as timely and significant for the Federation. The Caribbean Disaster Emergency Management Agency, SKNIS consultant for the audit, Denise Murray, has more on this story.
Here at SKNIS and across the Caribbean, it's a timely exercise whereby we are engaging the Federation in an audit tool. Think of it as an assessment. Think of it as feedback, critical feedback to this process. And it is a way to engage our key stakeholders on the Twin Islands or in the Twin Islands. So the Federation has embraced it. NEMA as well as NDMD from NIVIS has embraced this process, and we are looking forward to listen to our stakeholders and to have a dynamic event and project.
The National Emergency Management Agency, NEMA, and the NIVIS Disaster Management Department, NDMD, have all embraced the project. Claricia Longley-Stevens, Deputy National Disaster Coordinator, noted that the audit was significantly important, adding that St. Kitts and Nevis has been engaged in the CDM mandate over the last 6 years.
We recognize the value of it as it relates to enhancing our own capabilities at the National Disaster Offices, but also in our country work programs, where we are expected to outline some of the accomplishments, the legislation, the projects, and anything that would help to get disaster management on the road to resilience, where we're making our Twin Island Federation a more resilient state.
SKNIS is a regional intergovernmental agency for disaster management in the Caribbean community. The agency was established in 1991 as CDERA, Caribbean Disaster Emergency Response Agency, with primary responsibility for the coordination of emergency response and relief efforts to participate in states that require such assistance. It transitioned to SKNIS in 2009 to fully embrace the principles and the practice of comprehensive disaster management, CDM, which is an integrated and proactive approach to disaster management and seeks to reduce the risk and loss associated with natural and technological hazards and the effects of climate change to enhance regional sustainable development. The government of St. Kitts and Nevis has made significant investments within the security sector to curb the increase of violent crimes that plagued the Federation for over a decade through an intervention initiative dubbed the Alternative Lifestyle Pathway Program, ALPP, which targets individuals who were engaged in criminal activity or under the influence of gangs. Major Coyote Sutton, coordinator of ALPP, gave some insight on the program as well as some of the benefits.
The Alternative Lifestyle Pathway Program, ALPP, commonly referred to as a PEACE program, is a program carefully developed by experts in the field of social intervention, crime and violence, and to lend an opportunity to at-risk individuals in our society, to provide them with a second chance to live a life free of crime and violence, and to learn to become productive contributors and respected members of the society. It focuses on the at-risk, marginalized, disenfranchised, and traumatized in our society, and also persons meeting these criteria that are in need of being re-socialized, having been released from incarceration.
Over the years, the program has allowed for several at-risk individuals within the Federation to develop businesses, which in turn have created employment opportunities for other persons. Major Sutton indicated that the ALPP is now at phase 3 of its overall plan of action, focusing mainly on life skills training. That was the SKNIS Week in Review for February 25th to March 3rd. I am Sherma Matthew. See you next week as we continue to update you, the general public, on what's happening in and around the Federation.